This is Dr. Robert Buys with an introduction to intravitreal injections. You've been referred to the retina clinic for an injection which is going to go inside your eye in hopes of controlling either macular degeneration or possibly macular edema or even a vascular inclusion that could have occurred in your eye. Today we're going to be talking about macular degeneration. You may have received some mailings from our department. One is a more detailed explanation of macular degeneration, and the second one is a more detailed explanation of intravitreal injections. Macular degeneration can be broken down into both wet and dry macular degeneration. Dry macular degeneration occurs when there's a wearing away of the natural substances in your eye related to age. Current therapy for macular degeneration, which is of the dry form, is generally related to nutritional and also avoiding things which may increase the degeneration, such as smoking. Future therapies may be available, but for now that's the extent of it. In wet macular degeneration, new blood vessels begin to grow up underneath the eye. In this artist's rendition, you can see that the macula is this curve-shaped structure here, and new blood vessels that begin to grow up underneath the retina, sort of like grass growing up underneath a crack in the sidewalk. When that happens, there can be leaking from the blood vessels and eventually bleeding, which will create the scarring and decreased vision in your eye, may even give you distortion and other forms of visual symptoms. The new blood vessels are responding to a signal in your eye, and the signal is making the blood vessels grow. You can sort of think of this if you go back to the analogy of grass growing up underneath a crack in the sidewalk. The grass requires water to grow. These new blood vessels require this signal to grow. We can give an injection which will take away the signal, and much the same as taking away the water for the grass. Without the signal, the blood vessels will involute and shrivel up and hopefully go away. The two most common injections that we do, the first one is called Avastin. Avastin is a medicine which was originally invented for control of colon cancer. The colon cancer requires blood vessels to grow, and it was discovered that injection inside the eye was beneficial. Avastin is currently not FDA approved for macular degeneration. However, it is very effective and is probably our most commonly injected medication. A second very common injection is called Lucentis. Lucentis is a smaller piece of the Avastin molecule, and it is also used frequently. However, because of the cost and that is incurred from Lucentis, and that usually the Lucentis is not required initially, this is an injection that is oftentimes used if other therapies fail. Another injection which is commonly used is called Macugen. Macugen was our first medication that was injected, and is used oftentimes to maintain the therapy related to macular degeneration. Now, what will happen to you today, or when you come in, is that your eye will be numbed up and prepared as if it's going to be going to surgery. It sounds pretty scary that you're going to have a needle injected into your eye, but you're going to find that the process won't hurt. Once the eye has been numbed up, the injection is given, and you may see a stream of the medication going into your eye. Trapped air bubbles may occur, and you may see little round balls that will gradually resorb with time. Sometimes the injection recreates a pressure in your eye which is so great that the blood supply is interrupted, and for 5 minutes or so you won't be able to see. However, we will monitor your pressure very carefully. After the injection is over, you may notice that your eye will become red and irritated for the first 24 to 48 hours. We ask that you begin an antibiotic usually before the injection and also continue the antibiotic after the injection. Injections are usually administered every 6 weeks, and at a minimum you'll require 3 injections. These injections have been the greatest advance in the treatment of macular degeneration. And for the first time in history, actually, we're able to measure the effect of a therapy based on improved vision instead of those who don't lose quite as much. So this is a very exciting advance, and we certainly hope that these injections will prove to be valuable to you. We look forward to seeing you in your next clinic visit.